Aborigines and Torres Strait Islanders make up about 1.6% of the Australian population. A large proportion of these people live in northern Queensland, and in particular the Peninsula and Torres Strait Health region. As healthcare professionals, we should be equipped to detect illnesses in this important group of patients and to provide the most appropriate treatment. Experience says we are not. This video is a tool to help us provide better health care for Aborigines and Torres Strait Islanders. Its purpose is to show that an awareness of the social, cultural, economic and environmental factors that influence this group can have a profound effect on your ability to provide appropriate care and treatment. It is designed to make you better equipped to do your job by applying the skills and knowledge at your disposal, and by being aware that seeing and hearing is not always believing. We need to start from the basis that the process of applying Western-style medicine tends to prevent us providing proper care to this group of patients. We've studied medicine at medical school and university for years. We've grown up with the technical and scientific aspects of medicine. And we're used to a society in which the doctor has great importance and cultural status. As a society, we are comfortable, in varying degrees, with the clinical sterility of waiting and examination rooms. We accept that the doctor needs to enter our personal space, examine our bodies, and ask detailed questions regarding past and present family members. They advise us what to do, and generally we do it. Many of the people you may be treating here in the Peninsula and Torres Strait Health region do not conform to these cultural values or obey the same rules and hierarchies. In fact, although Aboriginal and Torres Strait Islanders tend to be treated as one homogeneous group, they are in fact two very different societies, each with their own values and cultural hierarchies. The patterns of illness are also very different, and some illnesses may be quite different in the two groups. For instance, diabetes is very much more common in the Torres Strait Islanders than in the Aborigines. Western-style medicine is not perceived to be a part of the normal healing processes by the Aboriginal and Torres Strait Islanders. They may be uncomfortable in our modern hospitals. In a hospital setting, we expect compliance as a normal part of the doctor-patient relationship. But Aborigines and Torres Strait Islanders may have very different expectations. White settlement in this country has seen epidemics of smallpox, measles, influenza, and records show that there were no epidemics of these illnesses before white settlement. Because of the short time span since white settlement, these diseases have only been prevalent in the community for a short time, and as a result, the Aboriginal and Torres Strait Island communities are relatively immunocompromised. They have not had time to become resistant to these diseases, They may present with illnesses which deteriorate very much more rapidly than we would expect in a white population. They may appear well 1 minute and deteriorate to a state of being very ill within a matter of hours. These illnesses may be complicated by poor diet and nutrition, or by the heavy use of alcohol and tobacco, which may damage their immune status further. Also, remember that when you're confronted with somebody with an acute illness, remember that alcohol also may complicate the clinical picture. The underlying factors behind the most common illnesses are very varied. Many of them can be attributed to the environments in which people live. The incidence of numerous infectious diseases is increased by harsh, unhygienic, or impoverished surroundings. People who live in substandard housing without power or piped water are predisposed to transmission of skin, respiratory tract, and gastrointestinal conditions. We need to bear in mind that Aboriginal and Torres Strait Islanders may have problems in explaining their symptoms. This may be because of problems with language and perception, or it may be because of cultural problems in communication. It is therefore very important to use the simplest of terminology when making a diagnosis. A very effective way of doing this is by using pictures or diagrams as well as speech. This may help to encourage your patient to do the same. The things to look for in diagnosis are pneumonia, domestic violence, occult septicemia, intestinal parasites, streptococcal infections, which can cause rheumatic fever and rheumatic heart disease, renal disease, especially in children, and diabetes, which affects 20 to 25% of the population over 25 years of age, Torres Strait Islanders in particular. Experience has shown that skin infections are the most common reason for a visit to a doctor. Despite your treatment, you may find when you return that your patient is not yet better. This may well be because the patient has shared the medication with other members of his community or family. You may find that a course of antibiotics has not been completed because the patient stopped them as soon as they started to feel better. Being aware of these problems may make the difference between making an accurate and an inaccurate diagnosis. In addition to these, we must be aware of restrictions based on beliefs and cultural communication difficulties.
Well, many Aboriginal and Torres Strait Islander people believe that a lot of the illness they get is not caused by disease or whatever, but are caused by puripuri. Puripuri is a term that we Aboriginal and Torres Strait Islander use for when someone casts a spell upon us. And there's very little what Western medicine can do when someone thinks that they've had a spell cast on them. And usually that's where our traditional healers are very valuable. These traditional healers could be men or women, and they're known throughout this region. People know who these traditional healers are. And when they feel that they've had a spell cast on them or someone pointed the bone at them, they go and see these traditional healers. When it comes to eye contact, a lot of non-Indigenous people take this as being shyness or being rude or being ignorant. But to us Aboriginal and Torres Strait Islander people, we find it very embarrassing. In some communities can be considered rude. Take it as a mark of respect if someone's not looking you in the eye, because the only time Aboriginal person and Torres Strait Islander people look you in the eye is when they're angry, and they hold that stare, and then you start feeling a bit uncomfortable. And that's the only time Aboriginal people will hold eye contact, is when they're angry. Try not to be too disturbed when a patient arrives early or late for their appointment, because most time they're going on Murray time or TI time. Time, as in what, is Aboriginal people are still trying to adapt to that white man what. Aboriginal and Torres Strait Islander people get offended very easily by your tone of your voice, by your body language, and if your body language come across very strong, it can make your work very difficult when dealing with Aboriginal Torres Strait Islander people. Male doctors are acceptable and very respected by Aboriginal and Torres Strait Islander people. But in some cases, male nurses are not acceptable, especially with older Aboriginal and Torres Strait Islander women. Aboriginal and Torres Strait Islander people show their emotion differently. And this could be misleading, because people might think that they don't care for the sick person. But it's just that we don't get involved physically or by touching or holding hands. And for instance, like if you go to a funeral, especially in the Cape or the Torres Strait, people will just come up and shake your hand and walk away, and sometimes they won't even say anything to you. But we still know that they do care, and this is our way of coping with it. In most cases, older Aboriginal Torres Strait Islander people will visit their doctor with a family member. This is because a lot of times there's a lot of communication problems, such as the older person not understanding what the doctor is saying to them, or maybe the older person can't express themselves properly to the doctor. Also, it's very important to get permission if you're going to discuss any family history. We need more local and appropriate education to talk about the diseases in our Aboriginal and Torres Strait Islander community. This also will help to bridge the gap between non-Indigenous people and the Aboriginal and Torres Strait Islander people. The first step to a successful consultation with Aboriginal and Torres Strait Islander people is to treat them with respect and sincerity, as you would treat any of your other patients. For instance, an Aboriginal and Islander patient could have been sitting in your waiting room, and they have observed how you treated the patients before them. And if the doctor comes out and sees the Aboriginal and Islander person sitting in the waiting room, will say, "Oh gee, this is an ATSI person, how should I treat them?" Then if you start thinking like that, you're just going to make your work harder for you to communicate with that patient, because the patient will probably see this as being discrimination. The following scenes in this video is just a guide to help you to understand a bit about Aboriginal and Torres Strait Islander culture.
So what's the matter, James? Are you sick somewhere? Not sick? Do you hurt somewhere? Can you point to where you hurt? Okay. Something private, is it? Okay. Been there for very long?
Yes.
And it's sore. Okay. Do you want to show me, or do you want to show Roderick, the health worker? You'd rather show Roderick? Okay then. All right. In this situation, it's probably best to get a male health worker to come and talk to James. If we can't get one at the moment. If I keep talking to him, he'll probably let me know exactly what the problem is, and we'll take it from there. Okay, what's you come up for today, Bamboo?
The reason I come up there, but there's no award money, but, I didn't like to tell you all about it. And when I come up there and I look, I need award money now, all the ladies, and I was very proud to talk to you. And I said, well, I think you lost thing at the meeting, one second.
So you got something private you want to say?
And I said, because the blind boy coming up to my private day. And I'll tell you all about it.
A few days ago, Bamboo had a problem. He had a blind boil on his private part, and he didn't know how to come up and ask his sisters to have a look at it. So he went and he found a man in town who had to be our wardsman, and he told him, and the wardsman come and told us that Bamboo needed to come up. So we went and picked up Bamboo and brought him up, and then had to go through find out what was wrong. And we found that he had a boil there. So we fixed him up. It's nearly better. This morning we had a lady who should have been here before 9 o'clock. We've arranged with her a couple of days ago to come in and have her blood taken. It's important that the blood gets collected and down to Cairns as soon as possible, and for this to happen we have to arrange couriers to drop it off at the plane on time. This lady, it's not important for her to come at the right time. She doesn't understand all these things, and she came at 11:30 instead of 9 o'clock, so we've had to rearrange the schedule for her and arrange the blood to get sent to Cairns by private vehicle now. She was running on Murray time. This often happens, and we've just got to accommodate the people when they present. In relation to traditional healers, general practitioners need to be aware that there are a lot of other influences happening. Some people think the bone has been pointed at them, they've been stung, or puri-puri is happening, and they can present with something that you're not aware of. We had a young fellow who had been badly beaten and stabbed one night. He was also unconscious, but from the injuries that he had, which were to his chest and not so much to his head, we wouldn't have thought he should have been that deeply unconscious. He went to Cairns and he was down there for quite a few weeks, still unconscious and 24-hour care. He was so bad that they were going to send him to a nursing home. The family approached us, and the traditional healer, or witch doctor, was sent down. A week after he had spoken to or been with the boy, he was conscious and awake and up walking, and he eventually come back to the community, and he was the same as before the accident had happened.
A problem common to Indigenous peoples throughout the world is that their death and mortality figures are much worse than those of their white or urban counterparts. It is recognised that health services alone will not improve the most acute health problems faced by Aboriginal and Torres Strait Island people. The relationship between poverty, social disadvantage and ill health highlights the need to deal with the social, environmental and political influences on health. While this is a mammoth task on its own, we have shown that you can make a difference simply by being aware. Try to remember these main points when treating an Aboriginal or Torres Strait Island patient. They may be immunocompromised. They may present with illnesses that deteriorate fairly rapidly. Be aware of linguistic and perception problems. Use simple terminology and draw pictures if you have to. Know the differences in body language. Silence may mean confusion or wariness. But eye contact is often forbidden, and it doesn't mean ignorance. Check before asking personal questions about the family's history. Know that there is often very little understanding of modern disease or medicine. Remember, timekeeping is not a cultural issue. Appearances may be very deceiving. Body language and speech may not indicate the degree of distress that the patient feels. Treat the Aboriginal or Torres Strait Islander people with as much respect and sincerity as you would treat anyone else.